Good morning, and thanks very much, Sandra, for that introduction. So, as Sandra said, I'm with the UCD School of Medicine, supervised by Peter Doran and Dr. Sinead Holden. So, my overall project is integrating digital technologies for clinical trials, and my specific project is Prodigy ILD, which stands for Predicting Outcomes Using Digital Technology for Interstitial Lung Disease. So why are we focusing on interstitial lung disease? So it's a, It's a rare disease, it's progressive fibrotic, and it has a life-limiting course. And the main problem with interstitial lung disease is for treating physicians trying to come up with treatment plans and accurate prognosis for patients because of this unpredictable clinical course. So as you can see from the graph here by Levy et al., it shows progression can sometimes be rapid, sometimes slow, sometimes mixed, and it's hard to predict onset of acute exacerbations and indeed survival for these patients. Also, with it being a rare disease, it's difficult to design clinical trials with small sample numbers. So what's our solution? Our experimental approach will be to recruit a cohort of interstitial lung disease patients and to collect a comprehensive data set for them. So the diagram there is basically we want to create a virtual twin. So it's a digital twin, which is a virtual representation of the patient using this multi-source data. And what we want to do with this data is model it and use it to predict outcomes for the patients. So if we get this good model working, we can then use this as a cost-effective synthetic arm for our clinical trials. So this is just an overall schematic of our trial. So our study is going to recruit patients from St. Vincent's University Hospital clinics for IDL patients. We're hoping to get 50 patients to follow. We will give them an Apple Watch and an iPhone to collect biometric data, collect patient-reported outcome measures from an app, and we'll bring this to clinic. We'll export the data and upload it to our secure server along with clinic data. We'll analyse this data, model it to predict outcomes, and then hopefully use it for trials. So just going into it in more detail, what are we doing with our interstitial lung disease Prodigy data warehouse? So the data we collect, we'll go to the clinic, get all the medical history, details such as lung function tests, what medications the patients are on. The ILD nurses do a 6-minute walk test with the patients and see when do they desaturate, how many meters. And then all this data will be captured on the REDCap database, which is being put together by UCD CRC for us. And this will feed into our Prodigy ILD data warehouse. Then looking at our devices, so our Apple Watch will collect our activity data, so our step counts, along with it does an average 6-minute walk distance for our patient, and we can compare this against the clinic 6-minute walk test. We'll get our biometric data, including heart rate and blood oxygen levels, which would be relevant for these patients. This will all go and feed directly into the health app on iPhone, and when the patient comes to clinic, we can export this data and upload it to our warehouse. Then finally, our PROMs, so our patient-reported outcome measures, we're going to use MyCap, which is a companion app to REDCap, again set up by our UCD CRC, and patients will fill out symptoms, so they'll be prompted with a questionnaire on a weekly basis to give detail on fatigue, cough, breathlessness, health-related quality of life on a 3-monthly, a more lengthy questionnaire on a 3-monthly basis. All of this data will feed into our data warehouse, and we will join our data sets with our study ID unique identifier, and then move on to our analysis. So predicting our outcomes. So just to give an example, say we had a patient, and we would feed their data into our model. First of all, validate our data, deal with any missing data, feed it into our model, which will be put together by our input from our clinicians, and then have our 12-month prediction model, compare this against actual outcomes that we would get at 12 months and see if our prediction model is accurate, and refine it until we have it working, and then we can use it for trials. And along with this, we will be using regression analysis and comparing it to machine learning. So sorry, I think I'm over time. So thanks very much for listening.